Hi y'all, welcome to another installment of our Healthcare Fact Chat video. I am Claudia Lennhoff and I'm the Executive Director of Champaign County Healthcare Consumers, and I'm joined by my colleague
Adani Sanchez, Client Services Coordinator.
And today we're talking about a sort of crisis that Illinois consumers are experiencing involving Medicaid and the food stamps program. And unlike crises that we have covered in the past that were legislative in nature, this one is a little bit different. This one is brought about by administrative decisions involving the Medicaid program and the food stamp program. And so we're going to talk today about what's happening to consumers and why this is happening. So first, Adani, I wanted to ask you, what kinds of problems are consumers experiencing as you're working with them to help them with Medicaid and food stamps?
So consumers are experiencing long delays. Their applications are taking forever to process. There's uncertainty about benefits with this long time span to hear anything. So they don't know if the application has been received, if they need more documents, if it was filled out incorrectly. And then we're also seeing clients who have had their benefits just dropped. And they don't know why, they're not sure, they haven't had any communication from the state, and so then they try to get something done and they don't have their benefits active, and so then they're kind of stuck in a lurch trying to figure out how this happened.
Okay, so normally when somebody applies for Medicaid, how long should it take before they hear back?
It should take 45 days, and that's like a law. If it takes more than 45 days, then they're entitled to receive at least temporary benefits during the time that they're waiting for a decision.
Okay, so you're saying that right now it's taking much longer and it's hard to ascertain the status of the applications.
Right.
And then in addition, you have people who have been applied and approved, but then they lose their benefits without any notification, and they don't know why, and it's not just because they're at the end of their benefit period.
Exactly.
Can you give a couple of examples of consumers you've worked with who are living out these problems and what that looks like for them?
Yeah, so one of the main ways that people decide to come to us is that they tried to go to the pharmacy and tried to get a medication and realized that they did not have coverage. And so that's usually the first sign that people have had that something is wrong with their benefits. So no contact from the state, but trying to get something with their benefits, and then it gets rejected. And
then they can't pay for their prescriptions unless they're paying completely out of pocket.
Exactly, because it's not being covered.
Okay.
Other issues that we've had are people trying to get procedures done, trying to escalate into something serious, a surgery maybe, but when they realize that their medical card isn't active, then it can't be scheduled. So people who are waiting to kind of get these things done, who are waiting through prior authorizations or something now, are waiting even more, and who knows how long they're going to wait, because now their benefits have been dropped, the surgeries or the dates have been canceled, and they can't reschedule them because they have to have active benefits at the time that these things are sometimes scheduled. And then we also have some difficulty seeing specialists, not even procedures, but trying to get into a department that maybe is really hard to get into. And if it doesn't look like you have health insurance, it might cause some problems or delays in trying to get into those specialties.
I see. And is it disrupting other kinds of care, for example, babies' immunizations and things like that, making sure that kids are getting their immunizations on a timely basis?
Yeah, that's another really difficult one. So when a baby is born and you add them to your medical case, if there's a delay in getting that baby approved for medical care and medical coverage, it delays these things like first checkups, vaccinations, all these things that are really important to have your baby out in the world and to be able to safely have your baby out, and important for that growth and development. So it's causing a lot of problems in that front as well.
And then for us as an organization that helps people who are going through these problems, what does it mean for you in terms of if somebody comes to you and they find out that their health insurance has been dropped and their appointment for a procedure has been dropped, or they've lost their food stamps, or they can't get their prescriptions? Is this extra work for you and for our organization?
So it's what we do. This is what we do, but it does take a lot of extra time to kind of we're becoming detectives and trying to figure out exactly what happened, when, and what what we can do to kind of figure out where to address this problem, because some cases are here locally, some cases are out in a different unit. Sometimes, depending on the situation, we can try to get things expedited. So it's a lot more kind of external work beyond just the normal things that we do. So it seems like we're kind of doing a lot more research and digging into when things happen, why they happen, try to figure out how best to help each particular consumer in their specific situation. So that is kind of building up a lot more hours of just trying to figure stuff out.
Yeah, so more time spent on the phone, more time spent cleaning up, trying to fix things after the state of Illinois messed things up. Okay, well, now we're going to talk about why this is happening, and I won't get into a ton of details about it. We would encourage people to look at our website, because we actually have, at the top of our website, we have information about this issue, but it sort of comes down to two factors, and I'll talk about the first one. The first one is that the state of Illinois, under the Rauner administration, made a contract with a company called Deloitte, which many people may have heard of, but Deloitte was supposed to provide this sort of software to the state of Illinois that was going to make more efficient and streamlined the process for applying for benefits such as Medicaid and food stamps. It was supposed to reduce labor, reduce time, and just make everything more efficient. And it turns out that Deloitte's program has lots and lots of glitches, and we don't know if these are the glitches that are really not so much bugs but features of their program, if this is how they're giving the state the cost savings that they promised from people losing their benefits, or what it is. But it's really a problem, and this has been happening in other states as well. So it's not just the state of Illinois. This Deloitte company is really a problem for Illinois and for other states. But then, how about on the caseworkers end of it? How are they dealing with this, or what can they do about it?
So that's actually been very difficult. The system that was built to sort of make things more efficient for the caseworkers even is now something that they can't even manage. So sometimes caseworkers will tell us that they tried to manually change something in a case that was messed up by the system, and they can't make that change. They've said that they, were trying to stop certain automatic things from happening, but then it's increasing their caseload. And the state of Illinois, under Governor Rauner, let DHS remain understaffed. So now the caseworkers that do remain are now even more overwhelmed by the system that was supposed to make their jobs a little bit easier. And so now, with dropped benefits, with these difficult cases, with these changes that are happening without the caseworkers even knowing sometimes, are now creating more applications when we're just kind of, if there's nothing else that we can do, we just reapply and try to push hard to make sure that that application gets processed.
So just like you're having to do extra work to pick up the pieces and figure out what's going on, the remaining caseworkers are having also to do extra work and try to pick up the pieces, and they have a system that they can't really engage with to solve the problems. So we shouldn't get mad at the caseworkers. They're understaffed. This was sort of by design, as you said, under Governor Rauner. When people were retiring, they didn't add more caseworkers. So they're understaffed. They're overwhelmed, and it's all stemming from this glitchy Deloitte software. So we're just going to wrap up then. That's sort of the summation of the problem, how it's affecting consumers, how it's affecting staff here in our organization. We're all picking up the pieces for the state of Illinois and for Deloitte, whom the state of Illinois paid a lot of money to. And we at Champaign County Healthcare Consumers feel that the state of Illinois needs to hold Deloitte accountable, and that we would like to see people who have been harmed through this process be made whole again. And so stay tuned as we continue to investigate the situation and figure out what actions can be done. And again, we would encourage you to go to our website to learn more about this and see recent media coverage, including where we've been involved in the stories, and check it out.
Thanks.
Thank you.